Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. November is Lung Cancer Awareness Month, and while it's not the most common form of cancer in this country, it is the deadliest. Our guest today to talk about lung cancer and keeping your lungs healthy is Dr. Jamil Taji. Dr. Taji is a pulmonologist with Mayo Clinic Health System. Thanks for joining us today, Dr. Taji.
Thank you for having me.
Well, as a pulmonologist, you help patients with respiratory problems. We're talking about lung cancer today. How common is lung cancer?
Well, it's not the most common cancer. However, it is by far the deadliest cancer. And I generally like to start this off with an example. We're coming up to the end of the year here. And at the end of the year, Christmas, New Year, families are getting together, they're having a nice time, people make their New Year's resolutions. And come the next year, 220,000 of those people are going to be diagnosed with lung cancer. 160,000 of those people are not going to see their families or celebrate the next holiday with them. They're going to pass away. To give you an example and to give you something to compare to, the other four common causes of cancer, or the most common causes of cancer, are breast, pancreas, colon, and prostate. In order, prostate kills around 30,000 people per year. Pancreas, 35,000, breast, 40,000, colon and rectal combined, 50,000. If you take all of those and put them together, that's less than lung cancer. 160,000 lung cancer, 155,000 for other cancers combined. Worldwide, 1 to 2 million people per year die of lung cancer. Now, to put these numbers in perspective so that you have more of a visual idea, the number of people who die of lung cancer in the U.S. is more than the population of Mankato, North Mankato, Fairmont, and New Prague combined. Worldwide, it's as though you're wiping Idaho off the map every year. So, as you can see, it is by far the deadliest form of cancer, bar none.
Yeah, very sobering statistics that you have there. And so often, we hear of the other forms of cancer, the breast cancers, the prostate cancers, which are obviously very serious diseases as well. But lung cancer doesn't get the press as those other cancers, and it kills more people than anyone else.
Absolutely. When you think about the other cancers, we were talking the pink ribbon. The pink ribbon is very commonly associated, and people are very aware of the fact that that is breast cancer. However, there is nothing that people know about lung cancer in general. They know it's serious, they know it's out there, but there's not enough media for it.
Well, before we delve further into the topic of lung cancer, let's start out with the basics makeup of the respiratory system and how our body breathes, because as a pulmonologist, that's what you deal with on a daily basis. So talk about the respiratory system.
Okay, well, the respiratory system basically starts up in the nose and the back of the mouth. We take a deep breath, it comes in through both areas, comes down into the throat, which is the trachea is what opens up from that. The trachea is our main airway, the large airway that heads down through the throat and into the chest, and then splits into both of our lungs, the left and the right. If you were to follow that down, the airways get smaller and smaller until at the end of the airways, out in the edges of the lungs, you have things called the alveoli. The alveoli are almost grape-like sacs of the airway where most of the exchange of oxygen and carbon dioxide occurs. So we breathe in the oxygen, give out the carbon dioxide.
And the alveoli then transfer the oxygen to the blood?
Correct.
So what causes lung cancer?
There are the top 5 causes of lung cancer. Number 1 is smoking. Number 2 is smoking. Number 3 is smoking. Number 4 is radon. And number 5 is secondhand smoking. 80 to 90% of the causes of cancer are caused by smoking. 80 to 90% of cancer, of lung cancer. The remainder is caused by secondhand smoking primarily and radon. Radon is the second leading cause of cancer. In Minnesota, up north, we have a lot of radon up here. Radon, generally, it's a gas. It's present in the atmosphere, but it's present in very low quantities. And so, generally speaking, people don't have a problem with it. But up north, other than the fact that there's just more radon up here, it tends to accumulate in the houses. It comes out of the ground, and so the basement is going to be the first area that's affected. As you go up in the house, there's going to be less of it. But in Minnesota, what happens in winter is it's cold. People close their windows, their doors. There's not a lot of ventilation, and so it accumulates. When you breathe that in, and it's the second most common cause of lung cancer.
And it's odorless gas?
That's correct. There's absolutely no way to know it's in the house unless you test for it.
And it's a natural gas, is what you're saying. It's not caused by carbon emissions from vehicles or anything like that. It's just, it naturally comes out of the ground.
That's correct, yes.
So what are some of the symptoms of lung cancer? Are there symptoms?
There are symptoms. The problem is they're very nonspecific. They basically revolve mainly around the lung. So if you have a cough, either a new cough or an old cough that's changed, that's one of the symptoms of lung cancer. If you have an episode where you cough up blood, that's one of the symptoms of lung cancer that you should be aware of. If you get short of breath suddenly or over a period of a few months, something new for you, that's possibly lung cancer. Chest pain, wheezing, weight loss. You're not trying to lose weight and yet you continue to lose weight. That's one of the things you have to be aware of. As you can see, they're not very specific. I suppose the take-home point is if it feels wrong for you, you should have it checked out.
So I was going to ask you, a lot of those symptoms that you talk about, they could be something that doesn't necessarily mean you have lung cancer. You have a new cough or a change in your cough or you're short of breath. So when should you see your doctor?
You should see your doctor when it doesn't feel right for you. So everybody is aware of their own body to some degree. The key is not to sit on something, especially if you're a smoker, you used to smoke, you've lost some weight as well. As you start to see all these symptoms come together, go and talk to your doctor. If it's nothing, they'll let you know.
Is one of the biggest problems with lung cancer is that by the time that symptoms show up, that it's often too late?
Absolutely. The problem with lung cancer is, if you remember the respiratory system that we just discussed, the bulk of the lung is spongy, alveolar type tissue. We have no pain receptors there. There are no nerves that tell us that there's something in there. The only place we feel pain is out towards the side of the lung, and if the cancer is growing there, we'll feel it. It's almost like a sharp pain in the chest. And if it's more central, if it blocks one of the larger airways, then you can get things like pneumonia. You'll have the cough, you'll have phlegm that you're coughing up, and it can eat into some of the blood vessels, in which case you'll start to cough up a little bit of blood.
So let's talk about some of the risk factors, and we talked about them earlier too. Smoking. So if you're a smoker, obviously you should quit smoking. Does your risk of lung cancer decrease immediately when you stop smoking?
Not immediately, but it does go down.
Mm-hmm.
And absolutely, I mean, there's no doubt it's probably 90% of my practice is telling people to stop smoking. I can't overemphasize that.
And it's pretty obvious, smoking is, you're bringing in a chemical that's not good for your body and you're basically inhaling it into your lungs on a daily basis.
Right, exactly. I mean, it may be a little more extreme of an example, but imagine lighting a bonfire and putting your head over it and breathing it in. We wouldn't do that.
Right.
And yet we do it in small little cigarettes.
Secondhand smoke, another one of those risks. Avoiding secondhand smoke obviously lowers your risk of lung cancer as well.
Secondhand smoke, unfortunately, gets even less press than the rest of it. And the people who are going to be most at risk are people who have taken a decision not to smoke and yet live with a smoker. 25% of the deaths are caused by secondhand smoking. That comes up to about 8,000 people. That's actually more than melanoma, which is one of the cancers that gets a lot of press in the skin cancer side of things. And so it's not a small problem, and as you remember from my list, if you were to combine 1 through 3 as smoking, secondhand smoking comes right after radon.
And we talked about radon. What about some other chemicals? Are there other things like, I've heard of asbestos being a possible cause of lung cancer?
That's correct. Asbestos is a cause of lung cancer. It becomes even more of a problem in smokers. Fortunately, asbestos there was more public awareness of it in the 50s, 60s, and 70s, and so the government did take action. They started to tear down older schools and buildings that had the insulation with asbestos. It used to be that the people in the military, in the Navy specifically, had a lot of exposure to asbestos. And so nowadays you will tend to see it in the older generation, people who had those exposures. And to build on the chemical point of view, again, talking about smoking, there are more than 20 cancer-causing agents that we breathe in when we smoke. That's 20, each of which individually can cause cancer, and yet we take in 20 of them when you smoke.
So long story short, don't smoke.
Yes, there, I can't overemphasize
Right.
it.
What about family history? Does family history have anything to do with lung cancer?
Yes, definitely. Family history and genetics in general, it's an up-and-coming field in medicine. For many years now, we've discovered that genetics is playing a role in everything. But it is especially important in lung cancer. If you do have a family history of lung cancer, it's one of the big red check marks that goes next to your history when you come in.
And what about gender? Lung cancer, does it affect men more than women, or is it an equal opportunity cancer?
It is technically an equal opportunity cancer. However, historically, men were smoking more than women. And so we used to see lung cancer more in men. As men started to taper off, though, women started smoking later. When they started, when the equal rights and all that started to come towards women, they were able to do more in society. Unfortunately, part of that was smoking. And so even though it caught up later, it did catch up, and women are just as risky, are just as much at risk as the men are right
So
now.
there's no medical reason why lung cancer would affect men or women more. It's more socioeconomic factors.
Or correct.
What about testing? How do you test someone for lung cancer?
Well, testing actually is interesting. Most people who are caught with lung cancer are not tested for lung cancer. They come in for something else, and we find that they have lung cancer. If we were to want to look for it specifically, things like chest x-rays, CAT scans of the chest are the most common that we would use.
Once the diagnosis is made, how do you go about treating lung cancer?
The short story is we try and get it out. Unfortunately, lung cancer is staged in severity. You have stage 1, which is the least severe, and stage 4, which is the most severe. Stage 4 means the lung cancer is not localized to one point in the lung anymore. It's spread, most of the time outside the lung itself. And depending on which stage you have is what determines your treatment. The earlier stages, we try to cut out that part of the lung. We try to take out as little as possible, but to keep it as effective as possible. As the stage advances, you start to see more chemotherapy and radiation enter the picture as treatment modalities. Now, the unfortunate fact is, even when you take out a stage 1A cancer, the earliest form of cancer, at 5 years, 65% only of people will be alive. And so, despite the fact that we've caught it, it's relatively early, 65% is still the number of people alive at 5 years. Stage 4 cancer, less than 1% of people are alive at 5 years. Untreated, about 4 to 5 months.
Unfortunately, like we talked about before, this disease, it's the deadliest form of cancer, and often it is a death sentence.
It is. And the worst part about it is it could have been prevented.
Well, let's talk about prevention. How do you go about preventing lung cancer? Can it be prevented?
It can be prevented primarily the smoking we talked about. If there's radon that's an issue, testing. Testing is very simple. Any of the home improvement stores across the board, they sell little testing kits, 24 and 48-hour kits. Test your home for it. If the radon levels are high, there are ventilation systems that can be installed specifically for radon. Recently, over the last couple of years or so, there's an exciting new branch of prevention that's started to emerge in lung cancer, and that's related to screening. As you're probably aware, in a lot of the other cancers, screening is a big part of it.
Right.
So, for example, in the colon, colonoscopies. But previously, we couldn't screen lung cancers because, again, it's hard to take a look in the lungs and across the board on every single person. And so what they came up with is there was a recent study, large study. They did CAT scans on a select group of people, the higher risk people who smoke, etc. And they did CAT scans on them for a period of 2 years at specific intervals, and they found that they caught many more lung cancers than would have been found otherwise. Unfortunately, at this point, it's only available to that select group of people because it just wouldn't be practical. If we CAT scanned everybody, the benefit and the risk would outweigh the benefit at that point, just from radiation.
Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Dr. Jamil Taji, pulmonologist with Mayo Clinic Health System. A great topic, and thank you very much.
Yeah, thank you for having me, and thank you for giving it the importance I think it deserves.
Have a great day, everyone, and be healthy.